Hello everybody, good afternoon. My name is Deb Mastrolia. I am a nurse here at Hoag Hospital, and my specialty is neurosciences and stroke. You can see on the camera there that there's a bunch of alphabet soup after my name, and I always like to tell people about that. What it means is that I'm not just making this stuff up. I've been a nurse for 40 years, and I'm certified in critical care. I'm certified in neuroscience nursing, and I'm also certified in stroke nursing. So you can be assured that this is all evidence-based medicine that we're going to be talking about. So by the end of this, my goal is that you are all going to be stroke smart. There essentially are 3 R's to stroke. All right, reduce, recognize, and respond. So let's get started and talk about how to reduce your stroke risk. But before we do that, what are we talking about? What is a stroke? A stroke is brain injury. It's caused when there is a blood vessel to the brain that becomes blocked or bursts. So I always like to tell people it's all about the pipes that are bringing blood and oxygen to your brain cells. It either gets clogged or it starts leaking. When it's clogged, when there's a blockage, it's called an ischemic stroke. And that's most of the time, 87% of the time it's ischemic stroke. When the pipe is leaking and it's bleeding, that's about 13% of the time, and it's a hemorrhagic stroke. And there are different types of hemorrhagic strokes, and we'll talk about that later. So, every 40 seconds in the United States, somebody is having a stroke. So how many strokes are going to happen in the next half hour that we spend together? I always say too many. About 800,000 strokes occur in the United States every year, yet 80% of them are preventable. So what we want to do is learn the risk factors and prevent you all from having a stroke. Certain risk factors you can't do anything about: heredity, age, race, and we're going to talk about that. But most of them you can. And so I want you to feel confident that you're going to know how to change, treat, or control any of your risk factors. So what's out of our control? Age. Unfortunately, we get older day by day, and every 10 years after age 45, your stroke risk nearly doubles. And even though it seems like stroke is grandma and grandpa's disease, it really isn't. We see younger and younger people having strokes all the time. Children can have strokes. And I can tell you that right now in my stroke unit over there and the hospital on the hill, you could have a 30-year-old, a 40-year-old, a 50-year-old, a 60-year-old, and then our older patients, 70, 80, 90, and even 100. I think our oldest stroke patient was 107. If you have a family history, that increases your risk of having a stroke. So again, this is immediate family: parent, grandparent, sister, brother. You want to be aware of that and then take control of your risk factors. Race also makes a difference. Statistics show that African Americans have a much higher risk of death from a stroke, and Hispanic and Latinos also have unique risks for stroke. Gender also affects your risk, and unfortunately, women have more strokes than men, and stroke kills more women than men. And I always like to throw in this, it's not really a fun fact, but this fact. Did you know that twice as many women die from stroke than die from breast cancer? And when you think about it, everybody knows when Breast Cancer Awareness Month is. Everybody knows what the pink ribbon represents, and everybody knows that they should get their mammogram every year. But how many people know when Stroke Awareness Month is? And how many people really know the facts and figures and the risks and the signs of stroke? Not too many. When they do surveys, about 50% of Americans really know what a stroke is. So please know your risk factors. I'm glad you're all here with us today. Prior stroke, TIA, or heart attack also raises your risk of having a stroke. A person who's had a stroke has a much higher risk than someone who's never had one. We need to take a minute and talk about TIAs, or sometimes people call them mini strokes. So I'm sitting here in this room full of young people, and all of a sudden my face starts to droop, my speech gets all slurred, and my arm's not working, all right? They all go, oh my gosh, what is happening? I'm glad I'm here at this presentation because now they're gonna know. They think, oh, Deb is having a stroke. And they call 911, and by the time 911 gets here, I'm completely back to normal. That's a TIA. That's a transient ischemic attack. For a short amount of time, maybe there was a little blood clot up in that artery, but then my body was able to break down that clot on its own. Blood and oxygen got back to those brain cells, and I did not have a stroke. I had a TIA. And when brain imaging is done, say an MRI, it will show no stroke and no damaged blood cells, or not blood cells, brain cells. All right, so those were all the risk factors that you can't really control. But let's talk about the things that you can. The number one cause of stroke is high blood pressure. Can you control high blood pressure? Yes, you can manage your high blood pressure. All right, and we're going to talk about different things that you can do to manage that blood pressure. Normal blood pressure is considered 120/80. And American Heart Association in November of 2017 put out new blood pressure guidelines. So you can see on the screen here that 120/80 is considered normal. When the top number, the systolic number, starts going up and gets as high as 129, that's considered elevated blood pressure. Okay, you're gonna start walking more every day, you're gonna watch the salt in your diet, you're gonna reduce your stress. Then blood pressure, when it's between 130 to 139 or 80 to 89 for the lower number, the diastolic, that's when it's considered stage 1 of high blood pressure. And when you're meeting with your doctor, again, he's going to talk about the different things that you can do without medication. But then if it should start to climb to 140/90 or higher, that's when you need to start looking at possibly some medications to control the blood pressure. Diabetes. Having diabetes more than doubles one's risk of a stroke. Many people with diabetes also have high blood pressure, high cholesterol, and are overweight, and then this just helps to increase the risk of stroke even more. So managing your blood sugars when you're diabetic, managing that hemoglobin A1C and trying to keep it at 7 or lower is really important. Every 2 minutes, an adult with diabetes in the United States is hospitalized for stroke. So work with your doctor and try to manage your diabetes. How do you manage diabetes and blood pressure? By watching your cholesterol and watching your diet. So high cholesterol increases the risk of blocking the arteries. And if an artery leading to the brain becomes blocked, a stroke can occur. So how can we control cholesterol? Hopefully with diet and exercise, sometimes with medications. Sometimes you need to go on a statin in order to control that high blood pressure, high cholesterol. And statins have gotten a bad rap over the years, but I can tell you that most of our patients in our stroke program go home on Lipitor or another statin and have no side effects at all. So if you do, of course, you're going to work with your doctor and find out what medication would work best on bringing down those cholesterol levels. Diet. Okay, eat foods that improve your heart and brain health. So everything that you do for heart health improves your brain health, right? So eating foods that are vitamin-rich fruits, vegetables, the Mediterranean diet. People often ask me, okay, what's the best diet that I could follow for brain health? Well, the Mediterranean diet takes a look at fresh fruits and veggies, fish, low-fat meats, and olive oil for your fat. So you don't want to have high saturated fats, trans fats, as they all raise your blood cholesterol levels. And of course, salt. We want to watch the salt intake. And I love those two pictures, right? Everything that you do for your heart health, veggies and fruit, helps your brain. Physical activity. The weather is beautiful out there today, and it's getting warmer and sunnier, so let's all get outside and get active, right? When you're at home and sitting around, and I know we've all been isolated with COVID, but grab your mask and get out there and take a walk. Physical inactivity increases your risk of stroke, it increases your risk of heart disease, becoming overweight, developing high blood pressure, high blood cholesterol, and diabetes. You can see how they're all connected, right? So daily physical activity will increase your quality of life. You get in a good mood when you get out there and see the sunshine and smell the fresh air. So take a walk, take the stairs if you can, and do whatever you can do to make your life more active. The recommendation is that you get at least 30 minutes of activity in on most days. Now, some people, especially some of my stroke survivors, they can't tolerate 30 minutes of activity all at once. So what if you do 10 minutes in the morning and 10 minutes in the afternoon and then another 10 minutes towards the end of the day? That still equals 30 minutes, and it will help you. It will help you to feel better, and it will help your heart, and it will help your brain. Maintain a healthy weight. Watching your diet, physical activity will all help you maintain a healthy weight. If you're overweight, take steps to try and get your body mass index down and into a healthy range. So what is body mass index? Well, it's a calculation. You can Google it and put in your numbers and come up with exactly where you are. If you look to the left of that screen, are you in the normal range up to 24.9? Are you overweight up to 29.9? Obese goes up to 39.9, and then greater than 40 is really considered morbidly obese. So you want to work on getting a healthy weight, not a crash diet, and getting that BMI down. Tobacco. Don't use tobacco, okay? No smoking, no vaping, no smokeless chewing tobacco. Recent studies confirm that cigarette smoking is another crucial risk factor for stroke. And what's the science behind it? Well, the nicotine and the carbon monoxide in cigarette smoking damages the blood vessels, and that really makes it easier for you to go ahead and have a stroke. Atrial fibrillation. All right, atrial fibrillation. The heart is a pump. And there are two chambers on the top of the heart, and there are two chambers on the bottom of the heart. All right, the bottom of the heart are the ventricles. And when those ventricles pump, if they fibrillate, just kind of shake, well, that's a code blue. That's no pulse, and that's do CPR. But when the top two chambers fibrillate or don't have an organized rhythmic pump, that is called atrial fibrillation, okay? And when the heart is not beating in that organized pump, there's a chance that the blood will pool in that chamber, and then if you do get a good effective pump, that when it's pooling, it's going to form a clot, and then that clot will travel up to the brain. When that clot travels up through the artery to the brain, it blocks that artery, and that is when a stroke can occur. So atrial fibrillation, you might feel it as a rapid heartbeat. You might feel it as palpitations in your chest. And if you feel any of these things clinically, you need to talk with your doctor about it. And on EKG, if you looked at it, you can see there's a little shot of an EKG there on the screen. It's a very irregular heartbeat. If you have stroke risks associated with that atrial fibrillation, then the doctor will look at prescribing anticoagulants. And you hear about these anticoagulants for non-valvular atrial fib all the time on TV, right? For some Xarelto, Pradaxa, Eliquis, and Coumadin. We still use warfarin or Coumadin for atrial fibrillation also. So if you have known atrial fib, it really is important that you're following up with your physician, you're getting your anticoagulation meds if needed, and keeping your heart healthy. Carotid artery disease is another risk factor for stroke. All right, the carotid arteries come up here in the front of your neck, and they supply blood to your brain. When there's a narrowing, and you can see a picture of that plaque buildup, so a patient who's had high cholesterol levels over a period of time gets atherosclerotic plaque building up on the artery wall, and then let's say they become dehydrated, and the plaque gets inflamed. It could block off blood flow up to that whole side of the brain, okay? So carotid artery disease should be monitored for, and if you have it, there's a point where you could become symptomatic with that, carotid artery stenosis, and then you follow up with physician, might lead to carotid stenting, carotid endarterectomy. But again, you can see how these two arteries, these two roads, pathways up to supplying the brain with oxygen are really important to keep open and clear. So carotid artery disease should be followed up with a physician. Stay hydrated, all right? This seems pretty simple, okay? So dehydration has been linked with inflammation, with artery stiffness, with blood pressure regulation and other factors, and these can all cause heart disease and stroke. Drinking water throughout the day is one of the most effective things you can do to improve health and well-being. So I'm a real visual learner, right? So if you're dehydrated, imagine that the blood is more viscous, is thicker, and the platelets are going to get stickier and easier to stick together and form a clot, which could cause a stroke. So staying hydrated with water is really helpful and really simple. The thing is, if you wait to get thirsty, your tank is already empty, all right? So you have to keep that volume up. And as we get older, we lose our sense of thirst. So waiting until you're thirsty to drink more water is really not an effective solution. Trying to drink 8 glasses of water a day is a good general rule of thumb. Again, if you have heart failure, if you have kidney failure, you're going to want to talk with your doctor about what is acceptable levels of water to be drinking. But really try, and especially for my stroke survivors, I tell them, you know, fill up a water pitcher. And if you like it cold, put it in the fridge. If not, keep it out on the counter. And by the end of the day, that water pitcher should be empty. Because I mean, you need the visual to make sure that you're drinking all of that water. And if you don't like the taste of water, try slicing some green apples, some lemons, some lime, cucumber, mint. Put something in to naturally flavor the water, and that might help you find it more palatable. Staying hydrated. Don't stay hydrated with alcohol. Okay, if you drink alcohol, do so in moderation. Alcohol tends to dehydrate you, along with caffeine. I didn't touch on the fact that if you are drinking a lot of coffee or tea or colas and they're caffeinated, that caffeine also dehydrates you. So that doesn't get to count into the amount of water that you're drinking each day. But getting back to alcohol, the U.S. Dietary Guidelines, 2015 to 2020, the new ones haven't come out yet, say that people should limit their alcohol-related risks by drinking in moderation, which means 1 serving of alcohol per day for women and up to 2 servings per day for men. And when we did these presentations in a live audience, somebody would always raise their hand and say, well, how big is 1 drink? So you can see the visual aid there. 1 drink is considered 1 beer, 12 ounces, or I think it's 5 ounces of wine, or 1 shot glass full, I think that's 1.5 ounces of liquor. So again, if you drink alcohol, do so in moderation. Sleep, restorative sleep. we need to get enough sleep. Good sleep benefits your whole body, including your heart and brain, with good effects such as improved mood, memory, and reasoning. Our brains need time to shut down. We need time to let it all go and get a good rest. All right. Drinking alcohol and too much alcohol might put you to sleep quickly, but then you usually wake up, and that doesn't really help with restorative sleep. Some sleep medications can, but we have a great sleep center here at Hoag, and if you're having problems with insomnia, I really encourage you to see a sleep medicine doctor. Also, if you should notice sleep apnea, and usually it's the sleep partner that notices that someone has sleep apnea, and that is that snoring, 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 and then all of a sudden there's a long period with no noise, and then a big snore, snore, snore again. This could be obstructive sleep apnea, and it really increases your risk of having a stroke for that time period, and sometimes it's up to 45 seconds where someone is not breathing. The oxygen levels up to your brain really do diminish. So you can see to the right there, I liked this little picture. Sleep apnea hurts hearts. It can increase the risk of heart failure, your blood pressure, atrial fibrillation, resistant hypertension, type 2 diabetes, and stroke. So again, we want to make sure we're getting enough sleep and that it's good restorative sleep where we are breathing adequately through the night. So remember, those are the risk factors that we can do something about. Remember, 80% of strokes can be prevented if you control, treat, and improve your risk factors. Keep your risk factors low with regular checkups and treatment for any conditions if you have them. I know it's been a tough time as far as seeing our doctors, but I think we're all getting used to these virtual meetings. I'm getting more used to doing these presentations to a screen and not to a group of participants in the room. You probably all are getting used to telemedicine visits. You know, you do them on your laptop, on your phone, and then there are times where you can come in and see the physician. So we talked about the first R, right? Reduce your stroke risk. Let's talk about the next one, recognizing stroke symptoms. We used to teach the acronym FAST. Right? Now we teach Be Fast because we found out that there are some strokes. It's not that large of a number, but there are strokes back to the posterior circulation in the brain whose signs and symptoms we were missing. So now we teach Be Fast. So I want you all to be fast. The B stands for balance. The thing with stroke is 1 minute you're normal, the next minute you're not. Okay? So for balance, is there a sudden loss of balance? Okay, all of a sudden the room's spinning. That could be a stroke. Eyes, is there a sudden loss of vision in one or both eyes? Not like I need new glasses and it's slowly been getting worse. It's no, 1 minute things are normal, the next minute I have double vision, or maybe this half of the world becomes black, or maybe I lose all of my peripheral vision, but all of a sudden there's a change in one or maybe both of the eyes. F, the F stands for face. Is my face symmetrical? And then the next minute this side starts to droop, or maybe this side starts to droop. It really is, when you observe this, it really is like watching a movie and having somebody's face droop, but that's how much the face can change in just a matter of minutes. The A stands for arm. Is one arm weaker than the other? Speech, is speech slurred? And the T stands for time to call 911 right away. Do not drive this person in that's having a stroke in front of your eyes by yourself. By calling EMS, the patient gets right in, and when you put this person in your car and get on the road, you have no idea if their symptoms are going to get better or if their symptoms are going to get worse. So again, very important. How to recognize a stroke. Be fast, all right? Balance, sudden loss of balance or coordination. Eyes, sudden loss of vision or double vision in one or both eyes. Face, suddenly one side of the face droops. So if you're thinking you see a change, ask the person to smile and take a look and see, is one side drooping. If they're having a stroke, they won't be able to lift the side of the face. Arm, is one arm weak or numb? So ask the person to raise both arms. Does one arm drift downward, whereas before they were able to keep both arms up? That could be a stroke. And speech, is the speech slurred? Are they unable to get words out? Or are they hard to understand? And we call it word salad, and it doesn't make any sense. So ask the person to repeat a simple sentence like, it's a sunny day. Are they able to repeat it correctly? And if not, and there's no other reasons that really account for that, like too much wine, just having taken some pain medication, or some other reason why you think their speech might be slurred. If there's absolutely no reason and you have this sudden change, this could be a stroke. So you want to get that evaluated. And the T stands again for time to call 911. So remember that when you recognize these symptoms and you get a stroke victim to the hospital, the sooner you get them there, the sooner they get life-saving treatment. Every 4 minutes, someone in the United States is dying of a stroke. So I want you to remember, if you think it's a stroke, be fast, call 911. So what about stroke and COVID, right? Many people are scared to come to the emergency department, especially during the surges, right? The emergency rooms were crowded, and what we found was that many people who were having strokes and heart attacks were staying home. And then they'd come in 5 days later after the brain damage or the heart damage was done, and we really couldn't do much to help them. American Heart Association came out with a statement saying, the risks posed by ignoring heart attack and strokes are far greater than the risks posed by COVID-19 and seeking health care. It's safe to come to the emergency room. They screen people, so if you think you're having a stroke, please, please come to the emergency room where we can get you the emergency treatment that you need. So what happens when EMS arrives? When EMS arrives, they are going to try to establish what was the last time you saw the person normal without any symptoms. All right, Mr. Smith goes to bed at 10 o'clock. He wakes up at 6 o'clock in the morning to go to the restroom, and when he gets up, he's dragging his foot and his arm's not moving and his face is drooping. Mrs. Smith calls 911. When EMS gets there, they say, Mrs. Smith, what was the last time he was normal? Well, at 6 a.m. when he woke up. No, he was last normal when he went to bed at 10 p.m. And it's critical to figure out when the last time normal is, because that's what helps us to make treatment decisions, okay? When EMS arrives, they're going to want to know which medications the person is taking. And they're also going to want a cell phone number so that the doctors can ask them questions. The right care right away makes all the difference. It can save life and save the quality of life. So make sure that you call 911 to get transported quickly to a stroke certified hospital. Hoag is a stroke certified center. And when I say Hoag, I mean both Hoag Newport Beach and Hoag Irvine. When you get to the hospital, what's going to happen? Well, time is brain, all right? Each minute that we do not get blood and oxygen back to those brain cells, they die. Millions of brain cells die. So when the person hits the door, we start collecting timestamps and looking at how quickly we can get to the different tests and procedures and treatments that we need. Rapid brain imaging is the first thing that we need. So once we get this brain imaging, it tells us how much brain is at risk. And if there's a blockage in the artery, that's what that picture to the right is. You can see the right side of the brain there has plenty of arteries that are working, and to the left, there's a blockage. Once we get those CAT scans, we can make treatment decisions. Now, most of the time it's the ischemic stroke, right? The clot in the brain artery. And then we use clot-busting medication, IV TPA. Or if it's a large vessel, we use clot-removing devices, stent retrievers, suction catheters. 13% of the time, it's the bleeding type of stroke. So for a subarachnoid hemorrhage, where the blood is into the circulating cerebral spinal fluid and around the brain, that's usually due to an aneurysm, and there's special treatments that we do for aneurysms, coilings or clippings of the aneurysm. The other 10% of the time, it might be an ICH, an intracerebral hemorrhage. And for those, neurosurgery might be required. Most often it's blood pressure control and close observation in the ICU. Since most of the time, 87% of the time, it's an ischemic stroke, let's talk about the treatments that we can use for an ischemic stroke. The criteria that we need to know is last time seen normal, and we talked about that. Sometimes EMS might say, well, when was the last known well? Both phrases mean the same thing. When was the person acting without any stroke symptoms? Then there's a list of other inclusion criteria that the physician will go through. If the time from last time seen normal is 0 up to 4.5 hours and the patient meets all the other criteria, they might get the clot dissolving IV medication, IV TPA or alteplase. And we can use this for a small vessel stroke or a large vessel stroke. If it's 0 to 24 hours and the patient has a clot in a large vessel, so a large vessel occlusion, or a lot of times you hear the acronym LVO, then possibly if they meet criteria, they could go in for mechanical clot removal. And this is exciting that it's out to 24 hours, and that really has only changed over the past few years. So what I want you all to remember as I kind of wrap this up, stroke is a brain attack. It's often very preventable and treatable. You need to remember the 3 R's: reduce your risk, recognize the stroke symptoms, and then respond immediately so we can get brain imaging and then get the correct treatment that you might need. That is it for my presentation. Do we have any questions from the audience?
Yes.
Yes, we have questions. All right, they're writing them down fast and furious. And then we'll try and get them answered for you. Okay. So, blood thinner is anticoagulant, and aspirin can prevent a stroke. So, blood thinners anticoagulants are blood thinners. Let's start it with that. An anticoagulant is one of those medications that I talked about, Coumadin or Pradaxa, Eliquis, Xarelto, and they work in a different way than aspirin does. Aspirin is an antiplatelet. Both anticoagulant and antiplatelet can prevent stroke. Aspirin should be prescribed by a doctor. I really don't want anyone out there thinking that they should take an aspirin a day without consulting with their doctor, because aspirin can have side effects also. I can tell you that anyone who comes into our hospital and has a stroke or a TIA are evaluated for going home on an antiplatelet medication, either an aspirin or clopidogrel, or another antiplatelet. Anticoagulants, as we said, are reserved for someone with atrial fib possibly, or other diseases that might need an anticoagulant. Can eating red meat increase your risk for stroke? Now, I like a good steak every now and then, but eating red meat can increase your cholesterol levels, which in turn can increase your risk for heart disease and cerebrovascular disease or stroke. So eating too much red meat, doing too much of a good thing, moderation is the key always. So I don't want to say that you can't eat any red meat, but you should eat it in moderation. Is waking up in the morning the time when most strokes occur? Good question. No. We do not see an increase in strokes occurring first thing in the morning. We do see many strokes identified when you wake up in the morning. So I don't know if that makes sense or not, but the stroke actually happens sometime during the night when the person was sleeping, and then the symptoms are noticed in the morning. But not to say that, you know, most strokes happen in the morning. We see stroke patients throughout the day. And it looks like the final question, does the older you are, the more risk you have to have a stroke? Yes, absolutely. Absolutely. The statistics show that after age 65, every 10 years, your risks increase. So that's a risk factor we can't do anything about, but we have to try and manage the other risk factors and keep us from having any health issues. No more questions? So hopefully I was able to share some information with you today. Thank you all for joining us. Please share this information with your friends and family. And thank you.